This is your typical picture of nurses and nursing. It is traditionally viewed as a profession of caring. While it is not an incorrect perception, it unfortunately doesn't tell the whole story. Nurses do care, but they do so much more. They're advocates, they're educators, they're safety nurses, and they're leaders.
Nurses advocate for their patients wherever they work. The Code of Ethics for Nurses is clear about the extent to which nurses should advocate for their patients under their care. But nurses advocate in other ways too. State and national nurse conference committees call for abstracts from nurses of all educational levels. They are a great way to share information with your colleagues. Nurses can collaborate with professionals of other disciplines to create impactful presentations. Finding out what bills could have a meaningful impact on patients and the profession of nursing is important. Never underestimate the power of a few committed nurses. Eddie Bernice Johnson, House Representative of the 30th District of Texas and psychiatric nurse, was a co-sponsor of a bill that was eventually incorporated into the large Cures Act of 2016. She has never forgotten her psych patients. The American Nurses Advocacy Institute is an annual program designed to help nurses gain political competence. Nurses who are interested can apply through their state nurses association and must be endorsed in order to apply. Nurses spend a few days in October in Washington, D.C., and continue to participate in meetings throughout the year. As the largest body of healthcare workers, nurses can have a great impact on healthcare issues when they unite.
Nurses as educators. An important aspect of nursing is the role of nurses as patient educators. Nurses educate patients on disease processes and prevention, disease management and self-care, medical interventions, medications and their benefits and side effects, among other things. According to Sonia Flanders, in her article Effective Patient Education, Evidence and Common Sense, patient education may lead to enhanced knowledge, quality of life, and self-care, reduced hospital readmissions, and improved medication adherence. Educating patients requires knowledge and skills. Being an educator means staying up to date on evidence-based practice. Continuing education hours and furthering education through an advanced degree are important in being up to date and therefore able to provide current, accurate information to patients and their families. The American Nurses Association has defined continuing education as learning activities designed to augment the knowledge, skill, and attitudes of nurses and therefore enrich the nurses' contributions to quality healthcare. My role as an RN in a primary care pediatric office includes educating families on the importance of vaccines, along with what disease they prevent, the potential side effects and their symptoms, and how to manage those side effects. I also educate patients on how to prevent the spread of illness and disease. I do this by teaching proper hand washing, the importance of vaccinating, and the importance of yearly exams. I also educate patients and their families on medications and how they are administered. One example of this is how to use an updraft machine. I educate families on how to set up the machine, how to operate it, how to inhale the medication, as well as the side effects of the albuterol that is being administered. I also educate patients on routine lab testing and its importance. I educate them on how to provide dirty urine samples, walk them through the steps taken to complete a lipid panel, all while providing knowledge and alleviating fears.
Recent Johns Hopkins study claims more than 250,000 people in the U.S. die every year from medical errors. Medical errors are the third leading cause of death after heart disease and cancer. Nursing saw the problem, and they became part of the solution. They've created this role of a quality and safety nurse, where it's instituted in some healthcare agencies because they recognize the importance of promoting safety, and they look to nurses to provide this assistance. One study pointed out that work interruptions created a danger during medication administration. And so nurses were getting interrupted, whether it was receiving telephone calls while they were preparing meds, the noise in the environment, conversations by staff, conversations with patient, or even family members. So the goal was by using non-interruptive zones, or signage. And even one study used wearing a vest when they're preparing medication so that whenever anyone noticed that person wearing a vest, they wouldn't interrupt them. Issue that safety deals with is also communication. There are numerous relational challenges that healthcare workers face every day. They need to overcome barriers of clear communication. They need to work on balancing cultural needs of families and coping with challenging hierarchy within the care team. And so other studies with the safety nurse end up recognizing that healthcare can be a negative workplace where behaviors such as incivility, disrespect, and non-collaborative relationship, where they have an impact on productivity and also increased costs. So what they've done is empower nurses and their colleagues with knowledge and support as needed to embrace challenging conversations, teaching nurses to focus on team dynamics, the way clinicians relate to and work with each other. So another role of safety.
Nurses as leaders. Nurses have many different roles. Are you a leader? Do you have business skills and principles, professionalism, communication and relationship management, and knowledge of the healthcare environment? According to AONE, these are competencies needed to be a great nurse manager. As a nurse manager, I have a vision for the med-surg unit that I manage. Over the last year, I noticed an increased daily census on my unit. This led to discussions with the inpatient nursing director, and we were able to make a plan to get additional positions approved or full-time equivalents. The additional FTEs allowed me to hire nurses for each shift and additional PCTs on the night shift to staff 4 extra beds so we can support more patients. To fill these needs, I got to hire staff that I felt would positively add to the culture of the team. My greatest joy in working as a nurse manager is supporting nursing professional growth. I chose to fill 4 of these positions with nurse residents. Through one-on-one mentorship provided by their peers, the Center for Professional Development, and myself, all 4 nurse residents have stayed within the organization 2 years out, and 1 is taking on a leadership position on the unit. Why be a nurse manager? A nurse manager works as a member of the interprofessional team and can make decisions that access resources to positively influence the patient experience, quality of patient care, and staff satisfaction. Do you have a passion for quality, patient safety, and putting the patient at the center of everything you do? Then, according to the ANCC, a clinical nurse leader may be the position for you. Jess, as a CNL, noticed an increase in pressure ulcer rate on a med-surg unit. Through chart review, she identified that many of these hospital-acquired pressure injuries, HAPIs, have already been charted on and were already in the process of being treated by their home care nurses. Also, many of these HAPIs were in healing stages. Therefore, although the unit was taking credit for these wounds, they were not actually hospital-acquired. Jess identified a gap in the nursing charting that we were not timely assessing and charting on all injuries on admission and transfer to the med-surg unit. Jess used the Johns Hopkins model and completed an evidence-based practice project about documenting on pressure ulcers and came up with the Nth Degree Initiative. This initiative involves charting on high-risk areas for pressure injuries within 1 hour of admission or transfer to the unit. Now, on this unit, they have been below the benchmark according to NDNQI for the last 5 quarters. Why be a CNL? You can be a problem solver to improve care by rolling out nursing initiatives that directly affect patients and nurses.
The future of nursing is ever expanding with an electronic medical records and software that integrates with different systems. You also have nursing involving telehealth, which allows nurses to monitor patients without being at a specific location, but over the internet. Nurses are also getting involved with environmental health and dealing with contaminants. Nursing and education are utilizing simulation and online training. The future of nursing will become more complex, but also it will become more innovative.